Family planning, also known as childbirth spacing, is fundamental to the development of Nigeria. In recognizing its many benefits, the Nigerian Urban Reproductive Health Initiative organized a workshop for media practitioners in Abuja. Topics ranging from behavioral change to uptake of family planning were brought to the fore. It was not all lectures. Group work and different energizers kept the class active. Dr. Saratu Olabode-Ojo, Technical Director Programs, NURI 2, speaks on the importance of family planning. She debunks myths and misconceptions about family planning.
As part of the efforts for the Nigerian Urban Reproductive Health Initiative in scaling up and normalizing discussions on family planning in Nigeria, we're here training media practitioners from different media institutions at the federal level to improve their knowledge and awareness, and then also build their capacity in using family planning information in their programming, so that they also contribute towards increasing and supporting family planning discourse amongst the public, and also to provide the correct information on family planning, because what we also see is that generally there are a lot of myths and misconceptions regarding family planning used in Nigeria. And that's one of the problems that we have that results in low uptake of family planning services.
She harps on the need for more male participation and spousal consent.
What we have seen consistently is that men have been kept away from the discussion of family planning, although that is changing, but we need it to change more rapidly. Family planning is not a business for just women alone. Men are a key part of family planning. Many women need that support, the family support, the spousal support, the partner support, to be able to sustain their use of family planning. So what we're saying and what we're propagating is that just as when you think about family planning, you think it is a woman's business, family planning is also a man's business. It is important that a man thinks about the future, thinks about planning the future. There are a lot of benefits of family planning to a man. It helps him to plan his life, to plan his family, to plan his future. It reduces the stress on him, the expectations on him in terms of the number of people he needs to take care of, in terms of the obligations that he has to his immediate and extended family. So the benefits are generally also very prominent for the man. So I think one thing we also want the media to take away is that family planning is a man's business. Men are at the forefront of family planning, and we need them to champion the discussion of family planning and childbirth spacing in Nigeria. With family planning services, we encourage, or the information that people should know about family planning services is that family planning services are voluntary. They are voluntary services that you can take up after you have received comprehensive counseling on all methods of the family planning service. This is available where you have the green dot logo. So we encourage people to go to a health service provider that has been trained, a health facility that has a green dot logo, where they are sure that they would receive quality services. Now, what do you get by visiting these facilities that have this green dot logo? You're sure that you will be able to have all your questions and concerns answered.
What have these media practitioners learned so far?
About the training, it's been helpful to give us more knowledge or more highlights on family planning, to tell us there is no much, let me just say let me put it that way to myself, the effects that people are scared of about family planning. You just have to go to a clinic where you have good service providers to be able to talk to you about family planning. And we, as the media, should be able to help advocate for family planning.
The training has been an eye-opener for me personally. Well, so far I've learned how family planning translates to quality life, how family planning could help, families, you know, make meaning out of their lives, and the various methods of family planning, various contraceptives, and then as a media practitioner, I've also learned how to use my profession to, pass family planning messages and debunk a lot of myths that many Nigerians believe about family planning.
Before coming here, I didn't know so much about family planning. So I would say I just had a very little knowledge about family planning. But of course, coming here, it's been a wonderful experience. And I remember the first day of the training, I didn't contribute. I was just writing and writing because I needed to understand what the program was truly all about, and of course what family planning is truly all about, because I needed to get a background knowledge of what it's all about. So far so good. It's been a wonderful experience. Yes, I'm not married, so before I get married now, I now know what to do and how to space my children so I can improve the economy of the country.
One thing I have taken away from this training is how to communicate the messaging around family planning and how to encourage people to take up family planning methods and contraceptive use. So applying it to my organization it has helped to enhance, like I said, my knowledge of communication. So we do a lot of communication and education, and family planning is one key aspect of what we do in our organization. So going back to my organization, I have learned new ways of teaching people, of communicating to people, of educating people on how to use family planning methods and where to go to seek for these services if they need to do that.
When we go back there to the office, we're able to pass the message by letting people know the importance of it and to know that it matters most. It paid most for you to do what is needful. And what is needful there is just for the women there, and then the men too should try to guide their women along to know that child spacing is highly important. It's an ethics, because definitely it is not really going well for us right now, because when it comes to financial something, so definitely we need to provide as much as we can take care of the kids. So the advice from here to people is just for them to do what? To make sure, let's follow the ethics, as you rightly said. I know that the ethics good here for everybody here is child spacing is going to be important.
Other professionals lend their voices to the benefits of family planning.
A major impact I would say is the fact that journalists will begin to see media practice from a different lens, which is the lens of development communication. The lens of how does my media reporting impact the lives of the ordinary people. And I think it's something that is critical and missing in the way media is practiced in Nigeria. Nigerians are tired for news sake, as you will assume. I mean, like I said in some of the sessions, when you break those news, how does that affect the life of the man on the streets? How does that affect the life of the old woman, the old man in the villages? Media should be used to empower people, and when media is not doing that, especially for developing nations like Nigeria, then we are missing the point. We are missing the point. So it is critical that journalists begin to review and reassess their practice in line with development media or development communication, however I want to see it.
For us, we understand and we know that myths and misconceptions are rumors. So they are wrong information that the general public have about family planning. And what we do is we provide correct information through the different channels that we use at our community level. And that involves providing people with the facts about family planning and the different methods. And we also make sure we direct them to trained family planning providers, who we also call our service providers, who have been trained and have the requisite knowledge on the correct application of the family planning methods that are available.
With these huge benefits of family planning, who wouldn't want to explore these options for better living? Remember to consult with a trained practitioner. The green dot logo will lead you to them.